I'm treating patients as well as working as a academician. So almost more than 8 years of experience I have to treat patients and also in teaching. Yes, 8 years. I would say it's not a lot, but yeah, it's like you get to know your strong points, and you can now you are like basically after 8 years of experience. Now you know after seeing a patient itself, you can easily interpret what can be the differential diagnosis as well as confirmed diagnosis and what treatment will be more effective for the patient. And more importantly, what I feel is that as the experience you gain, you also learn your soft skills, which matters a lot when it comes to communicate with patient and treating patient. So yeah, that really helps. uh, Experience about physiotherapy has been like a roller coaster, I would say. Like when I started my journey as a physio in 2007, there were like lack of awareness, and people were still not so sure about physiotherapy field, like how it's going to work and all. And that since that time we were worried about the centralized council and everything. Right now also it's the same situation, but I would say it's a little bit better because now awareness is more. Especially COVID time helped us a lot to create more awareness. And also like so many state councils have come up, and also NCHP is going to be a good help for us. So that way I would say, like if I compare from 2007 to 2023, lots of changes. And now it's much better. Like it's very good to like have patient directly attending physiotherapy clinics and taking treatments. So that way it's really better. Talking Hi Sejal, so you're saying I'm fourth year student, but remembering second year mechanics is kind of difficult. How should I go about it? Well, I am kind of not so, let's say, surprised by your question, but I would say that biomechanics is something that you don't have to read or study regularly. But biomechanics is a kind of subject in which you just have to apply your knowledge in each and every conditions of a patient. Not only patient, actually, normal individual also you can see that. Like for example, you're just sitting in a clinic, you're observing your patient coming. You directly just see like how their weight bearing is going on. On right side it is more, left side it is more, whether their shoulder is up or high. Like by performing shoulder movement, you can check for the glenohumeral rhythm, or while performing the movement you can look for your lever system, whether it is grade 1, grade 2, grade 3. So basically when you start applying your biomechanical knowledge in daily routine activities, then your biomechanics is never going to be like you are never going to forget your biomechanics. It is like every day, every moment you will be living biomechanics. So that is the best way to practice physiotherapy with the knowledge of biomechanics. Sanskar Gupta, thank you so much. I'm definitely your comments and your support keeps me going. So please keep supporting, and just yeah. What about money in the field of physiotherapy? Well, there is a lot of money in field of physiotherapy. If you ask me right now, I have seen people earning, let's say, 1 lakh rupees, 1.5 lakh rupees, 12 lakh rupees also in a month. So unless like it's all about like your experience or expertise, your skills, and also like how you are working, where you are working, everything matters a lot in the earning purpose. But I can say that no physiotherapist is just simply sitting at home without doing anything if they are skillful. So if you have skills, I think you don't have to worry about earning money. You will always earn good money. Like patients present very differently from books, it's difficult to find the structural source of the problem. Well, it's not actually different. The thing is what that in books you are studying the normal biomechanics. Like you will study from where to where force should pass, or what is the kinematics, what are the kinetics, and all everything that you will study from the books. Now, what you have to do is when you are seeing patients, you have to apply that knowledge and find out what is not normal, and that abnormal thing you have to identify and have to make it normal. Like for example, if you have must seen like my series of videos on mechanism of injuries of IPL injuries. So in those like Kane Williamson, Topley, or let's say recently I posted a video about Rizwan Khan, which was an old video. But again, in that, by looking at the mechanism of injury itself, we can come to know, yes, fine, this should be the injury, like depending on the what mechanism is there. So how would you understand that? Only unless and until like you have a very sound knowledge of anatomy as well as biomechanics. Then only you can just find that answer. You can do the diagnosis accurately. So that is the thing I'm talking about. So from books you just study the normal stuff and then after that try to apply it on the patients. Hello Pravesh. Yes, communication is a very crucial, it's very important factor, especially for us physios, because we physios don't not only treat patient physically, we also treat them psychologically. And I will tell you one more thing that when it comes to patient and physiotherapist relation, in compared to other healthcare profession, what happens? Let's say if a patient goes to a doctor for some consultation, they are going to ask for their problems, they will prescribe them medicine, and then they will just ask them to leave. So which means that they have connection with the patient hardly for 5 to 10 minutes. But when it comes to physiotherapy, physiotherapy session goes for 30 minutes, 45 minutes, sometimes 1 hour also. So that means you spend more time with the patients, and that time how you communicate with your patient, that means a lot. So that is why your communication skills are very important when it comes to treating patients. I'm done with my bachelor's and internship, but struggling what to do now, having difficulty to find a good MPT college. Well, Pravesh, you already decided that you want to do MPT. Now you just have to do one thing, that you need to find out like in which specialty you're more interested in, and plus wherever you're staying or wherever you're looking forward to practice in future, that area, what is the demand? Like obviously, see, if I talk about orthopedics, cardio, or let's say common neuro, their demand is always there. Okay, so if you are doing masters from any of these branches, you will have a good demand. But if I talk about like other branches like OBG, then cancer or oncology, or let's say other branches of the physiotherapy, and you want to do masters in them, then you have to do a little research in your city, in your town. How's the crowd? How's the population? What is the awareness level? And depending on that, you should start your MPT. Uh, Abindya Dev, can we expect more live case presentations like the back pain video you did recently, and when will be the next part of that video come? Yes, definitely. I am actually very excited to post such videos, but as I mentioned in last video also, that most of the patients are not comfortable with shooting their assessment and everything. But yes, I will try my best that more and more patients I try to show you the assessment part and skills, how to do that. And talking about the next part, already shooting everything is done. So most probably this Sunday you can expect that treatment part. This Sunday or before the Sunday, I'm going to post that video. And thank you so much for being on this live session. Keyur Agarwal, after BPT, if abroad is not an option, then which further things should be done in studies and courses so that in India itself we can survive healthy? Very good question. Keyur, see, if you are not interested to going abroad, there are lots of opportunities in India. Also, you can do your MPT. You can, if you don't want to, if you don't, if you're not much interested in MPT, you can start your clinical practice. Once you are skillful, you feel confident, you can start your own setup. Let's say that you are good in management skills, you can also opt for MPH, MHA courses, or you can also opt for MBA in sports management, or such courses which are like you can work with the teams, or else you can do some fellowship programs, specialty programs from certain places for only one particular part of the population, like for example stroke population, neurological conditions, or sports conditions like that, and you can continue your work over here in India. So I would say that lots of opportunities are there. So but one thing is that before starting, just decide, have a focus that I want to do this and keep on working on that. सर फिजियोथेरापिस्ट की जो ऑर्गेनाइजेशन है वहाँ फिजियो की सैलरी फिक्स करने की बात रखी है. Actually the problem is, star person, your question is valid, your request is valid, but the main problem with us right now is that we don't have any centralized council. And because of that, even if like I am saying, you are saying, lots of physios are saying, This practically we cannot manage it. Why? Because no management is going to listen to you. They will just look for their own benefits. So unless and until one centralized council is formed, some norms are there that minimum this much pay has to be there. Like for example, nursing council is there, so they have some norms fixed that this much basic salary has to be there, so they cannot pay less than them. So that kind of norms, once it comes for physiotherapy field, then I think so we can put this request. And for that we all only have to work. It's not that only one person speaking about it. Like if all together are asking for it, for centralized council fixed norms, then only it is going to be possible. I will say that I am struggling for it. Like I am raising voice against it since 7 and 8 years, but still I am doing it, and I'm going to continue it. uh, Next is how to examine golfer's elbow and what are the effective physiotherapy exercise for this. Golfer's elbow is kind of very easy because it is also known as medial epicondylitis. So you can say that on the common flexor origin, whenever patient complains of pain, especially when you're applying resistance or stretch to the flexor muscles, and patient complains of pain in that particular area, that confirms your diagnosis for golfer's elbow. And according to research's recent advances, it suggests that eccentric activity of wrist flexors treats this golfer's elbow condition in a very good way. So you can try that. Any suggestion? Okay, your point on doctor prefix in physiotherapy, it's controversial. Well, the very good question. My point on this is like if you can see on my videos or anywhere, I personally believe that calling myself physio is much better than doctor. But still, I don't know. Some of the people don't understand it, or some of the people have gone against me also that why you want to call yourself physio and don't want to call yourself doctor. And I am saying that doctor is not important, but respecting your own profession, loving your profession, being proud of being physio is most important. And that is why I believe that I call myself physio prem shah. That makes me more proud. So it's choice of yours. And yeah, that's the way it should work, I think. Okay, talking about any suggestion on which hospital we should do an internship and we can apply for it? Yeah, I'm. And what are your thoughts on Fortis Hospital right now? I'm in the last year of APT. Sanskar Gupta, thank you so much for asking this question. Well, I'm going to post one video about what to do during internship. So that video also is going to come soon. So just wait for that. And talking about which hospitals you should do, so I would say any hospital which provides you more exposure of the patient. Like it is like in internship time from morning 9 to 5, you should not be free. You should continuously see patients, observe, treat patients. If that kind of exposure you are getting, any hospital is good. Fortis Hospital, of course, it has a good name. If we are getting good number of patients, you can go ahead with that. Love to watch your videos. How much patients you cover in a day? Well, it depends from day to day, but almost because I am working as an associate professor, also I have to take lectures also. So average number of patients I would be seeing in a day will be 5 to 6, and other parts will be like clinical teaching for my own students and lecture taking for my students. Which books will be good to refer for MSK treatment? Well, musculoskeletal treatment, I would say. Uh, See, if it is sports related injuries, you can watch it. You can read it from Karim Khan. If it is orthopedic point of view, you can learn it from Jayant Joshi, John Ebnazar, or let's say there are also certain books of ACSM guidelines in which some good protocols are given. And most importantly, you can find recent advances and good protocols from the recent articles as well. So you can see articles from good websites like you can see it from let's say, yeah, why am I not remembering this? Well, I'll just mention that in some time. So there are certain good articles that you can get it from this such websites or online from the journals and Scopus journals that can be very helpful. What is the use of learning for this many years and there is no pay for us after BPT? We in Mumbai hospitals and clinics are offering 8 to 9 or 12K. Okay. But talking about it again, Anand Singh Purohit, okay, I understand that hospitals are paying less, but this is you are talking maybe for the freshers. Just imagine that if you have 1 or 2 years of experience, you are already improving on your skills, you are getting home visits as well as you can start up your own clinic, then the earnings are going to be good. See, on the fresher basis, my recommendation is initial 3 years you should invest only for improving your skills and making connections. Initially, if you're looking forward only for the money and not improving on your skills and making connections, it's not going to work out easily for any cases. Thank you, sir. Since I would start my internship soon, so do you think it would be beneficial to attend new workshops during this period, or should I do after my internship? Well, Anindya, internship is the best time to experiment with your skills and learning new skills. So my recommendation is like if you can do some authentic workshops during your internship, that would be much better thing in compared to after, because after internship you have to like be ready. You have to start your career. So that time all your skills has to be ready. So in during internship time, how much ever skill improvement, upgradation you can do, the more chances you are getting, you should take it. Uh, thank you. Chiropractic is dominating in physiotherapy. I heard about it almost everywhere. It is that much helpful, and that's why it's famous. Let me tell you this, Azad Raz, that see, chiropractic was always there. Even like it's a complete different branch from physiotherapy. Even osteopathy is there. Even I would say manual therapy is there, right? So what does it do is chiropractic means you are making adjustment, okay, like just like bone setter. But after that, unless and until you are working on the muscle balancing or movement analysis or movement functioning, it's like a temporary settlement for your pain or dysfunction. So, and physiotherapy is something which works for the permanent solution of your cause. So yes, initially it looks like that chiropractors are doing like perfect job for the patient, but as you must have seen, like follow-ups for after chiropractic also is that much only. It's not a permanent solution. It's just a temporary relief. So for permanent solution, obviously you have to give them some exercises, muscle balancing, and for that physiotherapists are the best ones. So what if we all physios tweet to the all ministry like Modi ji has minister other people to create our centralized council, but we all need to create an organizations. Your opinion? I have a strong opinion about it, but the thing is, already Modi ji has given us have included physiotherapy under NCAHP. If you have not seen, I have already posted a video about NCAHP. You can see that there are various norms given for the physiotherapy as well as other healthcare system. Basically, what they have done is National Council of Allied Health Professionals. In that, they have included physiotherapy also, and they have formed norms for them. And norms are very good if you say, but the only problem is that that thing is not completely in action. Once that thing comes in action, because that was formed in 2020 and this is 2023, since 3 years, if that has not come in action, that is the main problem. So I would say that if you really want to do something about it, then we should make sure first that we understand what is NCAHP and what is the role of physiotherapy according to NCAHP. Once everybody understands that, then we can start this movement to raise awareness to make this NCAHP activated. That is my opinion about this point. How to prepare yourself for internship after the final year exams? Well, when you're going for internship, first thing what you have to do is you have to just prepare for your future plans, like what exactly you want to do, whether you want to go abroad, whether you want to do MPT, whether you want to be in clinical practice, whether you want to improve your skills, whatever you want to do. So that you have to fix it once, and accordingly you can start your preparations. Good evening, music plus masti. Hello there, sir. Did you find difficult in studying electrotherapy back in days? As I do feel what this particular subject needs a lot of research, especially in therapeutic current. Well, Rinsen Raju, there are lots of research already present about the therapeutic current as well as all the electrotherapy modalities. So if you want to just go back and see those researches, I would say that you just go through this, because so many researches about recent modalities as well as previous modalities are already available. Is there any particular guidelines for internship like for DCPT, Haryana Council of Common Council related to internship? I don't think so. There is any particular guidelines for internship as such for now. But yeah, about again Haryana Council, I have no idea about. So we'll have to see for that. on my career and health industry. Thank you so much, Sanskar. Yeah, it means a lot. How to clear final year BPT? Well, final year BPT, see, you have come already so far. You have completed 3 years. Final year should not be so difficult for you. The only thing is keep on doing what you have done for the 3 years. Keep reading, keep studying, keep understanding the subject, and make sure you are attempting everything in the exam and you are just through the final year exam. How much you charge to your patients? So please tell us in number and tell me where you treat them. Do you have your own clinic? Well, I don't have my own clinic, but I treat my patients at college clinic as well as I work online. I take online consultations as well as I provide some treatments online. And about charges, it depends from patient to patient. Minimum is 400. It can go up till 800 also. And I will wait for the internship. Yes, soon it is going to come. Just some more days. I'm just occupied with so much work. So sorry for that. Sir, would it be wise choice to enter pediatric field during the masters, and how would I improve my skills for that? Well, it's always wise. We physios are there in each and every field, and remember one thing, that physiotherapy requirement is going to be there in each and every field, and the demand is growing day by day. It is never decreasing because of the like recent scenarios, people's lifestyle, everything. We physios are the only option for them to have better movement. So any field you go about improving your skills in pediatric, definitely you have to do some related courses like NDT you can do for pediatric. You can learn certain particular protocol like Boba, Brunstrom, anything which is required for you, roots approach or something, and that way you can continue practicing the pediatric physiotherapy. Uh, okay, master's degree other than MPT which are helpful exploring our way to the treatment. Well, other than MPT, if you want to explore your ways for the treatment, you should do fellowship program as I mentioned just now, or you can do like particular workshops or something short courses which are focusing on one particular technique. Like for example, McKinsey is there, MET is there, Mulligan concept is there. So these are the things which you can do it for your patients and for your skill upgradation. Is spinal extension good for low back pain? Any exercise recommendation for low back pain? Well, it depends on what is causing pain for you. Firstly, assessment is required, and then we can decide whether extension exercises are good or flexion exercises are good. Okay. While sitting for a long time on a chair, I rotate my trunk holding chair. Okay, is it good or bad? Doesn't matter. Doesn't matter, man. Lumbar spine cracks. That is normal. That is normal. Everybody does it. So it's cool. So what exercise we can do in supraspinatus partial tear? You have to make sure if it is acute condition, you can start with strengthening your all the other scapular muscles like rhomboides major, minor, middle trapezius, lower trapezius, and make sure you are performing movements below 90 degrees for internal external rotation. Once you gain confidence, then you can start increasing the range of motion. Along with that, you can perform the strengthening exercises. Salary of abroad physio in Indian rupee average. Vaishnavi Kadam, I would advise you to watch a video on my YouTube channel about the salary of physiotherapist, and that too I have given with the differentiation of countries. Like in this country, how much UAE, how much Europe, how much USA, how much Canada, how much. That will give you complete insight in that. India, which is the best place for practice. Uh, your hometown is the best place to practice. I would say that. About MSc osteopathy. Again, Prayag, the thing is, see, don't deviate from your field. Your field is physiotherapy, just stick to it. If you don't want to work like a physiotherapist, then you can deviate to any way. I don't mind it. But if you are looking forward to your career as a physiotherapist, then just don't deviate from it. Best physiotherapy to reduce knee arthritis. I think so. I have uploaded one or two videos about it. There are techniques of MW, movement with mobilization. Then there are certain techniques of exercises which we can use to strengthen the VMO muscles as well as to stretch your hamstring and calf muscle. Plays a very important role when it comes to knee pain or arthritic pain for the knee joint. So that is something you can use. Oh wow, it was amazing session, man. Thank you so much, guys, for connecting and coming up with so much interesting questions. So, any ideas or any suggestion for like when I should keep my next live session? Please mention in the comment section, because I was thinking that I will go live again every alternate days, so that we can have a better connection, and we can share our thoughts at what's going on, and you can give me some suggestions that what extra I should do to help you all again more and more. Yeah, me too. Looking forward, Azad. Thank you so much. Okay, every Saturday and Sunday, fine. I'll keep. I'll definitely keep it for the consideration. Saturday Sunday sounds good, but sometimes you know that Saturday Sunday will be busy. So, but still, yeah, we'll try my best. Research related project, yes. This topic I really want to talk about. So let's keep this topic for the discussion in my next live session. Definitely, we will start with this research related projects, because so many DMs, so many questions I'm getting about it. So I'm going to start with like how to select a project topic for the final year student as well as for the MPT student. So next live session, definitely. Every alternate days is fine. Perfect. Thank you so much. Will it take 2 years? No, 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 no. 2 years is long time. Say if he doesn't need to go for ACL surgery. Actually, second ACL not. It is like firstly only ACL reconstruction was not done. But yes, it will not. It's not going to take 2 years. It is going to take hardly 6 to 8 months, not more than that. All right. Okay, guys, if you have any other questions, then you can write me on my Instagram DM, or you can write under any videos comment section, or post comment section, because every alternate days I am also posting one question. So in that also you can write your questions, or else next time when I come live, we can continue with this question and answer. So thank you so much. Okay. See you guys. Thank you. Bye bye.